Today, we're tackling something that affects millions of us, or the people we love, the hidden dangers that might be lurking right in the medicine cabinet. We're going to get into why some of the most common medications out there can actually become risky as we get older, and, most importantly, what you can do about it.
So get this, about 1/3 of all adults in their 60s and 70s are taking at least 5 different prescription medications. 5! That's a whole lot to keep track of every single day, and it brings up a really important question.
You'd think if a doctor prescribes it, it's got to be safe, right? Well, it's a little more complicated than that. Just because a drug is prescribed, or even if you can buy it over the counter, doesn't automatically mean it's the right choice for an older adult. The reason why is pretty fascinating.
It really all boils down to how our bodies change. When we're younger, our metabolism is running faster, we process things pretty efficiently, but as we age, everything kind of slows down. That means medications can stick around in our system for longer and at higher levels, and that's what cranks up the risk for side effects. A medicine that was perfectly fine for you at 40 might be a whole different story at 70.
So, how in the world are we supposed to figure all this out? It feels overwhelming, I know, but thankfully we don't have to guess. There's actually an expert guide designed to help us navigate these exact issues.
It's called the Beers List. Now, I know it's a funny name, but it's an incredibly serious and respected tool from the American Geriatrics Society. And I want to be super clear about this. This is not a never take these drugs list. Think of it as a cheat sheet, a guide to help you start a really important conversation with your doctor about whether the benefits of a certain drug still outweigh the risks.
All right, let's get into the nitty-gritty. We're going to walk through 10 types of drugs that are on this list. Knowing what to look for is the first step in being a really great advocate for your own health or for the health of a senior you care about. Okay, first up, NSAIDs and high-dose aspirin. We're talking about things like ibuprofen. They can be really hard on the stomach lining and even cause bleeding or kidney damage in older adults. Then there's digoxin, a heart medication that can easily build up to toxic levels, causing all sorts of problems. Certain older diabetes drugs, like glyburide, can be risky because they might cause blood sugar to plummet to dangerous lows. And then you have muscle relaxants, and those common anxiety and insomnia meds, they can cause major sedation and confusion, which, as you can imagine, dramatically increases the risk of a serious fall.
Now for a few more. There's a big class of drugs called anticholinergics. Yeah, it's a mouthful. These can cause confusion, vision problems, and more. Estrogen pills and patches, often used for menopause symptoms, come with a higher risk of blood clots and even stroke. And finally, some antipsychotic drugs can actually increase the risk of stroke in older patients who have dementia.
Now here's one that catches so many people by surprise. We tend to think that if we can buy it right off the shelf at the pharmacy, it must be safe. But many of those PM pain relievers or sleep aids contain an ingredient called diphenhydramine. And guess what? It has those strong anticholinergic effects we just talked about, the ones that can lead to confusion and sedation, which again is a direct line to a higher risk of falls.
Phew. Okay, that was a lot of information about potential problems. But knowledge is only useful if you act on it. So let's talk about how to turn everything we just learned into a simple, straightforward action plan.
It's a really simple 4-step process. First, make a master list of everything you or your loved one is taking. And I mean everything. Prescriptions, over-the-counter stuff, vitamins, supplements, the whole shebang. 2, use what you've just learned to jot down any concerns you have. 3, schedule an appointment specifically to review these medications. Don't try to tack it onto another visit. And 4, go in with your questions ready. Ask things like, is this medication still necessary, and are there any safer alternatives we could consider?
Okay, I'm going to pause right here, because this is, without a doubt, the single most important rule. Please never, ever stop, start, or change any medication without talking to the doctor first. This guide is meant to help you start a conversation, not to make medical decisions on your own. Always, always talk to the doctor.
And that's really the whole goal here. This isn't about going in and confronting your doctor, it's about forming a partnership. It's about working with them to make sure the treatment plan is the safest and most effective one possible. So what are the big takeaways today? Number 1, you are a crucial advocate. Your voice matters. 2, medication reviews aren't a nice to have, they are essential for senior safety. 3, remember, the goal is partnership, not a fight. And finally, keep in mind that sometimes a risky drug might still be the best choice, but that's a decision that needs to be made together with a full understanding of all the pros and cons.
So I'll just leave you with this one question to think about. That one simple check-in,
That one 15-minute medication review. Could that be the most important health conversation you have all year? It just might be.